Good evening, everybody. Welcome to today's episode on sexuality education series. That is, weaker erections with age. Is it normal? Aging can change sexual response, but erectile dysfunction is not an inevitable part of aging. So, we will discuss it in detail. What may change with age? Erections may take longer to develop, more direct or sustained sexual stimulation may be needed, erection firmness or consistency may change for some men. Recovery time between sexual activity may also become longer. An important distinction is age is a risk factor, not the whole explanation. Erectile dysfunction becomes more common with increasing age, but aging itself should not be used to dismiss persistent erectile difficulty. Medical conditions, medications, lifestyle, and psychological factors often contribute. Many cases have more than one contributive factor. What is the bigger picture? Why can erection quality change? Aging is linked to vascular health. It is again linked to metabolic and hormonal factors, medications, and the lifestyle which they are using and adopting erectile function. Blood vessels health matters. So this is about the vascular health. An erection depends on an appropriate increase in peri blood flow. With age, cardiovascular risk factors become more common. Hypertension, diabetes, abnormal cholesterol, obesity, and smoking can affect vascular health. Persistent erectile dysfunction may therefore be an opportunity to review broader cardiovascular and metabolic risk. Hormones. What about testosterone? Testosterone levels can decline with age, but ED does not automatically mean low testosterone. Low sexual desire, fatigue, or other compatible symptoms may justify hormonal assessment. Testing should be clinically guided. Testosterone should not be simply as an anti-aging or sexual performance treatment without appropriate evaluation. Modifiable factors, medicines and lifestyle can matter. Some medicines may contribute to sexual side effects. Smoking, excess alcohol, and physical inactivity can increase ED risk. Poor sleep, obesity, and metabolic health can also influence sexual function. Never stop prescribing medication on your own. Discuss concerns with the prescribing clinician. Psychosexual health. This is also an important aspect. Psychological factors don't disappear with age. Stress and performance anxiety can occur at any age. One episode of erection difficulty may lead to worry about future performance. Relationship factors, depression, and anxiety can also contribute. Physical and psychological contributes may coexist. When should a man seek evaluation? A persistent and progressive reduction in erection firmness, repeated difficulty achieving or maintaining an erection, a significant change in sexual desire or spontaneous erections, leading together with diabetes, hypertension, cardiovascular disease, or other risk factors, sexual difficulties causing meaningful personal or relationship distress. What can a proper assessment include? Medical, sexual, and psychological, that is psychosocial history, also review of medications and cardiovascular metabolic risk factors, focus physical examination, selected laboratory testing when clinically indicated, and individualized plan based on contributing factors. So today's take-home message is aging can change sexual response, but erectile dysfunction is not an inevitable or routine part of aging. Persistent changes deserve evaluation for vascular, metabolic, hormonal medications, lifestyle, and psychological contributions. Do not simply assume I'm older, so nothing can be done. This is the common myth which we are seeing in our country. So everybody is saying the same dialogue, irrespective of the geographical location. Everybody is calling me and asking the same thing. But it can be done when you go to a proper sexologist, they will guide you and you can see the benefit. That's all for today. So, confidential education professional, continue your men's wellness education, subscribe for evidence based men's sexual health education, complement the complimentary 2-minute men's sexual wellness self-check. Link in the YouTube description. Instagram @sexologist_Dr. Karthik. DMN for self-check. Educational content does not replace individualized medical consultation. Thank you.